Welcome to the COVID-19, the common cold, and the flu presentation, a general guide to staying well. Our agenda for today is symptoms, testing, if you are sick, prevention, high-risk individuals, travel, and resources. Symptoms of COVID-19, the common cold, and the flu, what you need to know. People with coronavirus disease 2019, otherwise known as COVID-19, have reported a wide range of symptoms. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. These symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. When to seek emergency medical attention. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. Symptoms of the common cold include respiratory virus, runny stuffy nose, sneezing, productive cough, sore throat. It may lead to mild infections like ear and sinus, and it may last for 1 to 2 weeks. Flu symptoms include respiratory virus, high fever, body aches, fatigue, dry cough. It may lead to pneumonia, bacterial infections, or hospitalization. Symptoms are worse for the first 3 to 4 days, but linger for 1 to 2 weeks. Testing, types, and how to get tested. Two kinds of tests are available for COVID-19, viral tests and antibody tests. A viral test tells you if you have a current infection. An antibody test might tell you if you had a past infection. An antibody test might not detect a current infection because it can take 1 to 3 weeks after infection for your body to make antibodies. Having antibodies to the virus that causes COVID-19 might provide protection from getting infected with the virus again. If it does, we do not yet know how much protection the antibodies might provide or how long this protection might last. How to get tested for current COVID-19 infection. If you have symptoms of COVID-19 and want to get tested, call your healthcare provider first. Viral tests are used to learn if you have a current infection. During the federal public health emergency, Capital Blue Cross Health Plan members do not pay for COVID-19 testing and the related provider visit when the attending healthcare provider determines such testing is medically appropriate according to CDC guidelines. For the most current information about COVID-19 and other pandemic-related benefit changes that may apply, visit capbluecross.com/COVID-19. Decisions about testing are made by state and local health departments or healthcare providers. You can visit your state or local health department's website to look for the latest local information on testing. If you test positive for COVID-19 by a viral test, know what protective steps to take if you are sick or caring for someone. If you test negative for COVID-19 by a viral test, you probably were not infected at the time your sample was collected. However, that does not mean you will not get sick. The test result only means that you did not have COVID-19 at the time of testing. You might test negative if the sample was collected early in your infection and test positive later during your illness. You could also be exposed to COVID-19 after the test and get infected then. If you are sick, what to do? If you are sick, stay home. Most people with COVID-19 have mild illness and can recover at home without medical care. Do not leave your home except to get medical care. Do not visit public areas. Take care of yourself. Get rest and stay hydrated. Take over-the-counter medicines such as acetaminophen to help you feel better. Stay in touch with your doctor. Call before you get medical care. Be sure to get care if you have trouble breathing or have any other emergency warning signs or if you think it is an emergency. Avoid public transportation, ride sharing, or taxis. Separate yourself from other people. As much as possible, stay in a specific room and away from other people and pets in your home. If possible, you should use a separate bathroom. If you need to be around other people or animals in or outside of the home, wear a cloth face covering. Monitor your symptoms. Symptoms of COVID-19 include fever, cough, or other symptoms. Call ahead before visiting your doctor. Many routine medical visits are being postponed or done by phone or telemedicine. If you have a medical appointment that cannot be postponed, call your doctor's office and tell them you have or may have COVID-19. This will help the staff protect themselves and other patients. Wear a cloth covering over your nose and mouth. You should wear a cloth face covering over your nose and mouth if you must be around other people or animals, including pets, even at home. You don't need to wear the cloth face covering if you are alone. If you can't put on a cloth face covering because of trouble breathing, for example, cover your coughs and sneezes in some other way. Try to stay at least 6 feet away from other people. This will help protect the people around you. Cloth face coverings should not be placed on young children under age 2 years old, anyone who has trouble breathing, or anyone who is not able to remove the covering without help. Please take note that during the COVID-19 pandemic, medical grade face masks are reserved for healthcare workers and some first responders. You may need to make a cloth face covering using a scarf or bandana. Cover your mouth and nose with a tissue when you cough or sneeze. Throw away used tissues in a lined trash can and immediately wash your hands. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds. This is especially important after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. Use hand sanitizer if soap and water are not available. Use an alcohol-based hand sanitizer with at least 60% alcohol, covering all surfaces of your hands and rubbing them together until they feel dry. Soap and water are the best option, especially if hands are visibly dirty. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid sharing personal household items. Do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people in your home. Wash these items thoroughly after using them with soap and water or put them in the dishwasher. Clean all high-touch surfaces every day. Clean and disinfect high-touch surfaces in your sick room and bathroom. Wear disposable gloves. Let someone else clean and disinfect surfaces in common areas, but you should clean your bedroom and bathroom if possible. High-touch surfaces include phones, remote controls, counters, tabletops, doorknobs, bathroom fixtures, toilets, keyboards, tablets, and bedside tables. If a caregiver or other person needs to clean and disinfect a sick person's bedroom or bathroom, they should do so on an as-needed basis. The caregiver or other person should wear a mask and disposable gloves and wait as long as possible after the person who is sick has used the bathroom before coming in to clean it. Clean and disinfect areas that may have blood, stool, or body fluids on them. Use household cleaners and disinfectants. Clean the area or item with soap and water or another detergent if it is dirty. Then use a household disinfectant. When you can be around others after you had or likely had COVID-19. If you think or know you had COVID-19 and had symptoms, you can be with others after at least 10 days since symptoms first appeared and at least 24 hours with no fever without fever-reducing medication and symptoms have improved. If you tested positive for COVID-19 but had no symptoms, you can be with others after 10 days have passed since test and if you continue to have no symptoms. Now, please note, people with conditions that weaken their immune system might need to stay home longer than 10 days. Talk to your healthcare provider for more information. If testing is available in your community, it may be recommended by your healthcare provider. You can be with others after you receive two negative test results in a row at least 24 hours apart. Prevention. Stop the spread. There is currently no vaccine to prevent COVID-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person, between people who are in close contact with one another within about 6 feet, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some studies have suggested that COVID-19 may be spread by people who are not showing symptoms. The best way to prevent the flu is to get the flu vaccine. Those who have a low immune system and those who are around individuals who have a low immune system should be vaccinated. Because strains of the flu are different each year, it is recommended that you get a flu shot each year due to the changes. Talk to your doctor about the flu vaccine. Everyone 6 months and older is recommended for annual flu vaccination with rare exceptions. Different flu shots are approved for people of different ages. Everyone should get a vaccine that is appropriate for their age. If you have one of the following conditions, talk with your healthcare provider. They can help decide whether vaccination is right for you and help select the best vaccine for your situation. If you have an allergy to eggs or any of the ingredients in the vaccine, if you've ever had Guillain-Barré syndrome, a severe paralyzing illness also called GBS. If you are not feeling well, talk to your doctor about your symptoms. No, a flu shot cannot cause flu illness. Flu vaccines given with a needle are currently made in two ways. The vaccine is made either with A, flu vaccine viruses that have been inactivated and are therefore not infectious, or B, with no flu vaccine viruses at all, which is the case for a recombinant influenza vaccine. The flu can be a serious disease, particularly among young children, older adults, and people with certain chronic health conditions such as asthma, heart disease, or diabetes. Any flu infection can carry a risk of serious complications, hospitalization, or death, even among otherwise healthy children and adults. Therefore, getting vaccinated is a safer choice than risking illness to obtain immune protection. The reason for this is that a person's immune protection from vaccination declines over time, so an annual vaccination is needed to get the optimal or best protection against the flu. Flu vaccination has been associated with lower rates of some cardiac events among people with heart disease, especially among those who experienced a cardiac event in the past year. Flu vaccination also has been associated with reduced hospitalizations among people with diabetes and chronic lung disease. A study that looked at flu vaccine effectiveness in pregnant women found that vaccination reduced the risk of flu associated acute respiratory infection by about one half. There are studies that show that flu vaccine in a pregnant woman can reduce the risk of flu illness in her baby by up to half. This protective benefit was observed for several months after birth. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after handling your cloth face covering, after changing a diaper, after caring for someone sick, after touching animals or pets. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. You may wash your hands, but do you wash them well? There are a few steps to proper hand washing. First, wet your hands with warm running water and apply soap. Vigorously rub your hands together, making a lather, and scrub well for 20 seconds. Sing your ABCs to make sure it's long enough. Make sure to rub your wrists, back of your hands, between your fingers, and under your fingernails. Rinse hands under warm running water. Use a disposable towel to dry your hands, and if possible, then turn off the faucet with the towel and open the restroom door with the towel. Avoid close contact. Inside your home, avoid close contact with people who are sick. If possible, maintain 6 feet between the person who is sick and other household members. Outside your home, put 6 feet of distance between yourself and people who don't live in your household. Remember that some people without symptoms may be able to spread the virus. Keeping distance from others is especially important for people who are at a higher risk of getting very sick. You could spread COVID-19 to others even if you do not feel sick. The cloth face cover is meant to protect other people in case you are infected. Everyone should wear a cloth face cover in public settings and when around people who don't live in your household, especially when other social distancing measures are difficult to maintain. Cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. Do not use a face mask meant for a healthcare worker. Currently, surgical masks and N95 respirators are critical supplies that should be reserved for healthcare workers and other first responders. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then use a household disinfectant. Most common EPA registered household disinfectants will work. Remember to monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Especially important if you are running essential errands, going into office or workplace, and in settings where it may be difficult to keep a physical distance of 6 feet. Take your temperature as symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medications that could lower your temperature, like acetaminophen. High-risk individuals. COVID-19 is a new disease. Currently, there are limited data and information about the impact of underlying medical conditions and whether they increase the risk for severe illness from COVID-19. Based on what we know at this time, people with the following conditions might be at an increased risk for severe illness from COVID-19. Asthma, moderate to severe. Cerebrovascular disease affects blood vessels and blood supply to the brain. Cystic fibrosis, hypertension or high blood pressure. Immunocompromised state, a weakened immune system from blood or bone marrow transplant. Immune deficiencies, HIV, use of corticosteroids, or use of other immune weakening medicines. Neurological conditions such as dementia, liver disease, pregnancy, pulmonary fibrosis, having damaged or scarred lung tissues, smoking, thalassemia, a type of blood disorder, and also type 1 diabetes mellitus. Older adults. Among adults, the risk for severe illness from COVID-19 increases with age, with older adults at highest risk. Severe illness means that the person with COVID-19 may require hospitalization, intensive care, or a ventilator to help them breathe, or they may even die. Chronic conditions. People of any age with the following conditions are at increased risk of severe illness from COVID-19. Cancer, chronic kidney disease, chronic obstructive pulmonary disease, otherwise known as COPD, immunocompromised state, a weakened immune system from solid organ transplant, obesity, having a body mass index of 30 or higher, serious heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, sickle cell disease, and type 2 diabetes mellitus. Others who need extra precautions include racial and ethnic minority groups, residents of rural communities, people with disabilities, people with developmental and behavioral disorders, people experiencing homelessness, pregnant or breastfeeding women. Travel. Safety measures. If you travel, protect yourself and others during your trip. Clean your hands often. Wash your hands with soap and water for at least 20 seconds, especially after you have been in a public place, after touching surfaces frequently touched by others, after blowing your nose, coughing, or sneezing, and before touching your face or eating. If soap and water are not available, bring and use hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub your hands together until they feel dry. Avoid touching your eyes, nose, or mouth. Avoid close contact with others. Keep 6 feet of physical distance from others. Wear a cloth face covering in public. Cover coughs and sneezes. And pick up food at drive-through windows, curbside restaurant service, or stores. We will now review some popular questions for you to take into consideration when traveling. Is COVID-19 spreading where you're going? You can get infected while traveling. Is COVID-19 spreading in your community? Even if you don't have symptoms, you can spread COVID-19 to others while traveling. Will you or those you are traveling with be within 6 feet of others during or after your trip? Being within 6 feet of others increases your chances of getting infected and infecting others. Are you or those you are traveling with more likely to get very ill from COVID-19? Individuals who have an increased risk of severe illness from COVID-19 should limit their travel. Do you live with someone who's more likely to get very ill from COVID-19? If you get infected while traveling, you can spread COVID-19 to loved ones when you return, even if you don't have symptoms. Does the state or local government where you live or at your destination require you to stay home for 14 days after traveling? Some state and local governments may require people who have recently traveled to stay home for 14 days. If you get sick with COVID-19, will you have to miss work or school? People with COVID-19 disease need to stay home until they are no longer considered infectious. Anticipate your travel needs. Bring enough of your medicine to last you for the entire trip. Pack enough alcohol-based hand sanitizer, at least 60% alcohol, and keep it within easy to reach. Bring a cloth face covering to wear in public places. Prepare food and water for your trip. Pack non-perishable food in case restaurants and stores are closed. Take steps to protect yourself from COVID-19 when booking accommodations or planning an overnight stay. If you are considering cleaning your travel lodgings, see the CDC's guidance on how to clean and disinfect. Resources. For resources, please see the following: Case Management Services, NurseLine, your 24/7 nurse on call, Capital Blue Cross website at capbluecross.com, HealthWise Knowledge Base, found within your secure member portal, Virtual Care, Capital Blue Cross Connect, Centers for Disease Control and Prevention. Thank you for listening to today's presentation on COVID-19, your guide to staying well.